Hello, my name is Jessica, and today I'll be doing a physical assessment. I'm going to do a head-to-toe assessment on you. At any time that you feel like you want to stop and you don't want to continue, just let me know, okay? And everything that we do here is confidential, okay? The only person that will get this information is your other healthcare providers upon request and with your permission. My name is Jessica, and we're going to get started. First, I'm going to check your hair and your scalp. I'm going to be checking for looking at your face, blemishes, your smooth skin. You got one little mole right there. It's cute. And your face is symmetrical. You don't have any blemishes, no scars, no nodules. I'm going to start off by palpating your scalp. I'm going to feel your scalp for your hair distribution and your knots, nodules. You have no nodules, no protrusions, no pain, anything hurt. All right. Now we're going to move to checking his face. I'm looking at his facial expressions. They're symmetrical. His hair is evenly distributed. And I'm going to feel for your temporal arteries. They have a nice pulses present bilateral. It's not bounding, it's regular. Okay, the next thing we're gonna do, I'm gonna check your cheeks, your mandibular joints. And when I tell you to, I want you to open and close your mouth. I'll be checking to see if you hear or feel any clicking, or if you hear or feel any clicking or any pain or tenderness. Open, wide, and close. One more time. Okay. And close. Okay, there's no clicking present. And you didn't experience any pain or tenderness. Next, we're gonna check what is cranial nerve number 5. Cranial nerve number 5, I'm gonna have you to clench your mouth real tight with your teeth closed. Do the teeth like this. Do it again. Okay, against resistance, he held it well. All right, I want you to close your eyes for me. And tell me when you feel something by saying now.
No.
Okay, you can open your eyes for me. All right, that was cranial nerve number 5. Next, we're going to move to cranial nerve number 7. I want you to do a couple of things with your face. I'm checking your facial expression. All right? Okay, smile for me. Big smile. Frown. Close your eyes real tight. Open. Raise your eyebrows. Clench your teeth. Now, blow for me. Puff your cheeks. Okay, for cranial nerve number 2, what I want you to do is I'm going to check your visual acuity, see how your vision is distance. So I want you to put your glasses on. You wear glasses. Okay, and stand right here on the card for me. Now, on the eye chart, read the lowest, the smallest line you can read for me.
PDEOLCFTD.
All right, thank you. And that is the temporal line. All right, thank you. That was pretty good. All right, now I want you to do it again. Cover your right eye. Keep your glasses on, but cover your right eye. Now read the lowest line you can see.
FEZOLOTTD.
cover your left eye. Do the same thing. Read the lowest line you can see.
P E Z O L O T T D.
All right. Thank you. Okay. You can get back on the table for me. Next, we're going to do cranial nerves number 3, 4, and 6, which control your eye movement, your extraocular movement. And I'm going to use what's called the 6 fields of cardinal gauge. I want you to keep your head still, but I want you to follow my finger only with your eyes, okay? You're going to follow my finger with your eyes. Don't move your head, okay? Just follow my finger with your eyes. Okay, very good. His eyes follow symmetrically, simultaneously. And now we're going to check for cranial nerves 3, 4, and 6. All right, I'm going to use my light, and I'm going to be checking for your pupils. You can take your glasses off for me. And while I'm checking, I'm looking at your eyebrows. You got even hair distribution, your eyelashes, your eyelids. I'll be checking your sclera, or they're white, your conjunctiva. And it's pink, your cornea is pink, there's no drainage. Okay, I'm going to use the light, and I'm going to check your pupillary response. Okay, they both constrict and they react to light. Your pupils are equally responsive to light and accommodation. All right, now, like I said, you have no drainage, so it's pretty good. Your eye, your sclera is white, your cornea and conjunctiva are pink, and no drainage. Next, I'm going to inspect your ears. I'm just going to take a look at the outside of your ears. And your skin is smooth, it's round, there's no discoloration, no nodules. You have any pain or tenderness when I touch your ears? Okay. All right, just the outside of your ears. All right, I'm going to do the whisper test. It's called the whisper test. I'm going to cover one of your ears one at a time, and I'm going to whisper a word. I want you to tell me what I said.
Baseball.
Good. Don't look at me.
Basketball.
All right, real good. All right, next I'm going to take a look at your nose. Inspect. I'm looking at it now. It's symmetrical. It's midline. There's no nodules or anything on it. The skin is good. No breaks. No discolorations. No pain or tenderness? Okay. All right. Now, where you don't have any drainage. You have it for me? Okay. All right. Now, I want you to do this one side at a time and sniff. Let it go. Do the other side. Okay. Airway is patent. Okay. Now, I'm going to palpate your frontal and your maxillary sinuses. I want you to tell me if you have any pain, tenderness. All right? Just look straight ahead. Any tenderness? Okay. No pain or tenderness. Now, I'm going to take a look at your mouth. I'm going to inspect your mouth, and I'm going to be looking at your teeth, your gums, your buccal mucosa, and I'm going to take a look at it and see how that looks. All right. Open wide. It's hard and soft palate. Inner cheeks. Buckle close up. It's all intact. It's pink and moist. There's no abnormal drainage, no malodor, and his teeth open wide. Teeth are intact. Tongue is pink and moist. Everything is pink and moist. Okay. He has no lesions, no abscesses, and it's good color to everything. Everything is pink and moist. No blisters. All right. Now I'm going to check your gag reflex, and lift it up. Have a little tongue blade. And I'm going to have you open wide. And I'm going to stick this in. And I'm going to take another look at your uvula and check your gag reflex. Open wide. I'll put a little pressure there. Now, okay, lift your tongue out. Stick your tongue out for me. All the way out. Open wide. Tongue out. Say ah. Okay. And his uvula did move symmetrical with your gag reflex. Okay. Next, I'm going to palpate what are called lymph nodes. Okay. I'll be looking for any hardness. They're not supposed to be hard or painful when I touch them. All right. And I want you to tell me if you feel any pain or tenderness, okay? All right. We're going to start the posterior cervical, post-auricular, which is behind the ear, pre-auricular, it's in front of your ear. You got your tonsillar, chin up one, submandibular, submental, superficial cervical, deep cervical chain, and your supraclavicular. Right? Any pain or tenderness? No pain or tenderness. Okay. All right. Next. You okay? All right. Next, I'm going to be checking your range of motion. That's how your movement of your arms, okay? All right. Just follow my command. Take your chin to your chest. Okay. Back up. Hold your head back up. Okay. Now, take your head to your left. Now to your right. Now, do it again to the left. It's resisting to the left. No, to the right. I'm sorry. To the right. Now to the left. Okay, now touch your ear to your shoulder. One side at a time. Go to the left. Okay, now do it again. This way to the right. To the right. Now to the left. Okay. All right. Now take your head backwards for me as far as you can. All right. That's good. And you can sit right straight up again. Head up. Now shrug your shoulders like this. Now I want you to shrug your shoulders again. Okay. All right. Next, I'm going to palpate your thyroid and your trachea. That's your windpipe. Sorry, excuse me. Your windpipe. So, for this one, I want you to have a seat in this chair for me. All right, I'm going to give you a bottle of water. When I tell you to, I want you to sip the water. I'm going to be feeling for, I'm looking, hold your head up. Okay, this trachea is midline. It's symmetrical. I don't see any nodules or protrusions. Okay? Now, go to Adam apple right there. That's a hard little thing. And I'm coming down a little bit to your trachea right there. And a little bit to the side. Those are your thyroids. Okay? You can feel that? It's soft. It moves easy from side to side. Now, any pain or tenderness? Okay, take a sip of water for me. Okay, and it did move upward when he swallowed the water. Okay, you can. Yeah. All right, now I'm gonna palpate your carotid pulse on each side. Sorry about that. Okay. No. Okay, they're both strong and even, not bounding. Good pulse, regular. Okay. Now I'm gonna listen to those same spots, both your carotid pulses. I'll be listening for what is called a bruit. It's like a swish noise. If I hear the swish noise, that means you may have some occlusion and you need further evaluation. All right, we're using the bell on my stethoscope. Okay, that's good. Okay, they're both even and regular, not bounding, and no bruits, no swishing. All right, now, the next part, can you stand for me? All right, you should sit this way, face this way, over here. Now, you can remove your shirt for me. Okay, sit straight up for me. All right, I'll be inspecting his posterior chest, and I'm looking at it. His skin is normal in color. It looks symmetrical. His spine looks symmetrical. No nodules. Yeah, no lesions or anything on the skin. Now I'm going to palpate for tactile firmitus, starting at the top. And when I tell you to, I want you to say the number 99 every time. I'm going to say it again, and then you say it again, okay? All right? Say 99.
99.
Say it again.
99.
Again.
99.
Again.
99.
Okay. It's always, the vibration is even. No congestion is noted. All right, next, with my reflex hammer, I'm going to percuss those same areas, lung fields, and the sound should be the same in each one. Right? Start. All right, we're going to go here. All right. All of those are the same long sounds, same in all fields. Okay. Next, I'm going to listen to your breath sounds, same areas. Just want you to breathe normal. Just breathe normal. Alright. Breath sounds are clear in all long fields. Next, I'm going to percuss for the coastal vertebral flank pain on each side. And let me know if you feel any pain or tenderness. Any pain or tenderness? Okay. All right. Next, we're gonna move. You can get out the chair and get back on the table. I'm gonna inspect your upper extremities again. I'm looking at both of them. They are hands. The skin is good. No discoloration. He has no nodules. I'm palpating. Feel it's symmetrical. No lesions, no rashes, no nodules, no scarring. Now I'm going to palpate your brachial pulse. On both, I'm doing bilateral brachial pulse. You ready? You're not cold, are you? Okay. All right. With the bilateral brachial pulse, I am. Here, I'm gonna check both of them. Okay, they're both even, regular, not bounding. Then I'm gonna move down to your radial pulse. Put your arms over for me like this. And okay, they're both good and even and not bound in a regular rhythm. Okay, now I'm going to check your range of motion again. Okay, I want to take your arms, raise them above your head, straight up, all the way, stretch them all the way out, straight out. Okay, now put your arms behind your back. Okay, now go straight up, from like this. Now up. Now put it back down. Okay. Very good. That was for abduction and abduction. Very good. I want you to flex your elbows, take your arms straight out. Flex. Let them out. Okay. Now, do it again with me holding, with resistance. Take them down. Okay, good. All right. Now, do turn it in upside down. Turn them inward and turn them upward. Okay, that was for supination and pronation, range of motion. Okay, now, next I want you to make a fist and flex your wrists, both of them up and down. Okay, now do it against resistance. Okay, now spread your fingers for me. Close them. And take your finger, I want you to touch all your fingers with your thumb. All right, do this, lift your fingers for me. All right, okay, range of motion is good in for the upper extremities. Okay, now I'm going to check your cerebral function. I want you to hold your arms straight out, like this. Okay, Now I want you to take your finger to your nose, one finger at a time. Now do the other one. Left again. Don't turn your head. Left again. Try it again. Do the right arm. Now do it a little faster if you can. A little faster. A little faster. Okay. All right. Good. All right. That's good coordination of muscle movement. Okay. Now, what's next is called graphesthesia. I'm going to this a sensory function check. So I want you to close your eyes and open your hand. Open both hands. Now I'm going to draw a number in each hand. You'll have to tell me what it is as soon as I finish drawing it, okay?
8.
Close your eyes. Keep them closed.
6.
Okay, good. Now, I'll be doing stereogenosis. Stereogenosis, I'm sorry. Stereogenosis. Now, I'm going to close your eyes. Keep your eyes closed for me. I'm going to put something in your hand. You'll have to tell me what it is, okay? You ready? You can close it and feel it.
Penny.
Okay, keep your eyes closed.
Paper clip.
Okay. All right. So he was able to identify, so his cerebral function is good. All right. Next, I'm going to check your reflexes and for your triceps, biceps, and your brachial. All right. We're going to start with your triceps. Let it hang, let your arm hang, just like that. And tips up. Okay, through a reflex. Okay, next is your bicep. Loosen up. Okay, and reflex, you have a slight jerk. Now I'm going to do the brachial. Okay. All right. Since you reflex, you got a slight tweak here. All right. Next, I'm going to inspect your anterior chest. I'm going to do the front side of your chest. And I'm looking. Yeah, everything looks symmetrical. The color is good. You don't have any nodules, any lesions on your skin. And for this one, I want you to be comfortable. Okay, not cold. All right. All right, I am. His breathing is unlabored. There's no labored breathing. The chest is symmetrical. Everything, sternum looks midline. And his breathing, like I said, is unlabored. So I'm taking a look at palpating. There's no pulsations or heaves. Everything feels fine. All right? Okay. Next, I'll be auscultating for your heart sounds. Auscultating for heart sounds. I'm going to listen to your heart. Okay? With my stethoscope. All right? I'm going to start with the aorta over here to the right. Put your chin up. Okay? It's the second, third intercostal space. Listen for S1 and S2. Okay? Now I'm going to pulmonic. Tricuspid. And mitral. Okay? S1 and S2 are present. His pulses, heart sounds are good. Regular rhythm. Now I'm going to do the same areas again, checking for murmurs. Okay, I'm using a bell on my stethoscope. Your order. One moment. Tricuspid. And mitral. Okay. There are no murmurs present. Okay, no murmurs present in any of those locations. Okay, next we're moving to your abdomen. Okay, I'm doing a visual inspection of your abdomen. It is flat, you have a flat tummy. Your umbilicus is inverted, so there's no hernia. And I'm looking, your skin is fine, no protrusions. So, as I inspect, I'm also going to auscultate. Auscultate next and listen to your bowel sounds. Okay? I'll start over here as well. I'm doing all 4 quadrants. Bowel sounds present. 1, 2, 3. Bowel sounds present. And 4. Yeah, bowel sounds present in all 4 quads. Okay? All right. Now I'm going to listen to your bilateral renal arteries. Okay? And your aortic artery. I should not hear any bruits. Okay? Okay. Renal arteries just to the side of each side of the umbilicus. All right. Left. Okay. And there's no bruit or bilateral renal arteries or the aorta. Okay. All right. Now I'm gonna tap lightly on your abdomen. Okay. Not gonna hurt, but let me know if you feel any pain or tenderness. Okay. I'm gonna do all 4 quads, and I'm checking for sound. So this is dull or resonant. Okay. Dull is it should be dull over organs, and resonant over areas that don't have organs. Okay. Hold still. Okay. Any pain or tenderness? No pain or tenderness. Okay. And it was dull over the areas, organs, and resonant over areas with no organs. All right. Okay. You fine? Not cold. Okay. No pain, no tenderness. Okay. All right. Next thing I'm going to do, I'm going to palpate your abdomen. You know, I'm going to feel it. I'm going to feel over it. It looks good. I'm going to feel over the areas, and I'll be watching. You let me know if it's painful or tender to touch, and I'll be watching your facial expressions for some signs of discomfort. Okay? First, I'm gonna press light and do light palpation. Now I'm gonna go a little deeper. It might be a little harder, okay? Okay. All right. No pain or tenderness. The abdomen is soft and distended. Okay. Next, I'm going to palpate your liver, and what I'm going to do is here, I might have to put it right in. Okay. May have to get you to switch just below your rib cage. Both hands. Okay. And I did not feel anything. Okay. Nothing felt there. Should not be able to palpate the liver. All right. Next, we're going to check your lower extremities, okay? I'm going to have you to sit up for me. And turn back around for me with your legs on. Well, actually, no, you can't. Leg up, leg up. You take your socks off. Okay, now you can lay that down for me. All right, I'm doing a visual inspection of his lower extremity. Next, I'm going to do a visual inspection of your leg. I'm checking your lower extremities. Your skin is intact, no nodules. They look symmetrical. You got even hair distribution on your legs a little bit. Okay. All right. So now I'm going to palpate your popliteal, your tibial, and your dorsalis pedal pulses. Okay? I want to do both legs. And let me know if you feel any pain or tenderness. Okay? Both of those are present and regular, not bounding. The tibia, just into the inside of your ankle here. Okay, that one is present. Okay, and your pedal pulse. And both of those are present and strong. Okay, all of the pulses, the popliteal, the tibia, posterior tibial, and the dorsalis pedal pulses are present and strong, not bounding. Okay, now I'll check your legs for edema. You're just gonna squeeze a little bit, let me know if you're tender. You don't have any edema, the tibia area here. Good. Okay. All right. The next thing we're going to do, I'm going to check your range of motion for your hips. So I want you to raise your legs straight up in the air, one at a time, all the way up like this. One leg up, all the way up, straight up. Okay. Now do the other one. Straight up. Okay. Let it down. Okay. Now bend your knee to your chest. One leg at a time, all the way to your chest, let it down. Do the other one for me to your chest. Okay. All right. Now, turn your feet inward, turn your knees inward. Now turn them outward. Okay. All right. Now, take your legs out, spread them out. Now take them back in. Okay, together at the same time. Out and then in. Okay, thank you. All right, that was abduction and adduction. Abduction. Okay, for a range of motion of your hips. Okay, now I want you to take your feet and flex them up and down. And down. Okay, up and down. Okay, now you're going to do it with me holding with resistance. Going up. Now down. Okay. All right, pretty good. So we got a good reflex in both feet. Okay, now I'm going to check what's called a Babinski reflex. Okay, I'm going to stroke the bottom of your feet, and we're going to see which way your toes go. Okay, all right. You're starting on your left foot. Start at the heel, going upward. Okay, and his toes curl downward. Again on the right foot. And his toes curl downward. Okay, so he has a normal Babinski reflex. Okay, now you can sit back up for him. Okay, now if you want to, you can put your shirt back on. Okay, now I'm going to test your Achilles. Uncross your legs. I'm going to test your Achilles reflex. Okay? And right here. I'm tapping at the back of his ankle and Achilles. Okay, and his. Okay, we got a little jerk there. And we're going to do the left one. Just let it down. Let it fall. Okay. And we got normal Achilles reflex. Okay, now next is the patellar reflex. Okay, just be still for me. Light tap. Okay, now light reflex. Okay, both bilateral patellar reflex and Achilles reflex are intact. Okay, next we're going to do another cerebral function test. Okay, I want you to take the heel, uncross your ankles. I want you to take the heel of your left foot and go up the front of your leg, of your right leg. The front. Do it one more time for me. Now do it with the left one. Take your right foot and go up the left leg. Okay. All right. So he has a good cerebral function with that. Okay. Now, I want you to stand up for me. And stand up straight for me. I want you to walk on your heels. Walk this way, on your heels. On your heels. Walk back, on your heels. Now turn around, I want you to walk on your toes. On your toes. Now walk back on your toes. Okay, you can have a seat now. All right. Now, for Rombergs, stand back up for me. For Rombergs, all I want you to do is stand up straight. Stand straight. And look forward. And I'm just checking the posture. On the side, he has a good even posture with the normal curvature of his back. No kyphosis. Okay, now, can you lean forward for me? Okay. I'm gonna raise your shirt up for a minute, and I'm gonna check your spine. Okay, he has normal, it's not curved to the right or the left. Okay. Touch your toes for me. Bend over, touch your toes for me. Straighten your legs out. Touch your toes. Okay. Now come out a little bit. Stand back up. Stand back up, straight up. Step out a little bit. Now lean back as far as you can, backwards. Okay. Now stand up straight. Now twist from side to side. And in place. Okay, and one last thing. Yeah, come on. We're gonna turn back like you were walking the way, that way. I want you to hop on one foot. Now turn around and hop on the other foot. The other foot. All right. This concludes my head to toe physical assessment. And thank you.